This video shows the technique for the mint lift using all parallel threads to help the threads last longer. It's sped up to 2.5 minutes, even though the procedure took an hour to perform. I inject tumescently a lot of local, in this case 120 cc's of only 0.4% lidocaine with epinephrine, prep it with HiPoCleanse. I add extra local to the incisions and exits because those spots tend to bleed and hurt. I make 6 1.5 millimeter punch incisions, and then I'm passing 3 of these 43 centimeter threads. Each thread gets its own 2 holes, and then I use this passer, which is the double blunt cannula, passed in the deep subcutaneous space, one parallel to the other, and I pull back on the blunt cannula slightly to allow the sharp cannula to pierce the skin, and then I thread the needles and then pull out the sharp cannula. I do the same thing on the other side, once again making another 6 1.5 millimeter punch incisions using the temporal passer, not going deep, just deep enough to allow the cannula to go in there, and then passing these U-shaped threads, once again going in the deep subcutaneous space, superficial to the parotid. Obviously in this area is where you got to be more careful. You want to go where it doesn't hurt and there's not a lot of pressure, but you don't want to see any dimpling as you go along. You're staying superficial to the smaz. You want to pull any hairs out that may have gotten trapped and pulled in by the barbs. If there's any hairs stuck in these incisions, the incisions will not heal. You pull the face up as high, all the way into the hairline, so it's as high as actually will go. You push back on the skin, cut off the excess threads. And then you add sometimes a little more local. I then make 18 gauge needle holes just beneath the brows, essentially spaced 1 centimeter apart. And then I'm passing the mint fines. I'm going, and this is more of a backwards direction, going superiorly and going to the hub and beyond. You want to put that mint fine cannula as deep as it'll go. You have to help it bend superiorly because it's with your hands as you're passing it. Then you pull the threads up to get the lift and cut off the excess, release any minimal dimpling. You can always adjust it more later. One day later, you're seeing there isn't any bruising, but there is still a little swelling, and a week later, she is nicely lifted, including the tails of the brows. You get least effect. Essentially, these mint fines work better laterally.